81. Which of the following strategies is most effective in managing the motor fluctuations in Parkinson's disease? A. Increased levodopa doses. B. Physical therapy and exercise. C. Use of anticholinergic drugs. D. Deep brain stimulation. Answer: B. Physical therapy and exercise. Rationale: regular physical therapy and exercise are essential for improving mobility, reducing motor fluctuations, and improving overall quality of life in Parkinson's disease. 82. Which of the following changes in gait is often seen in patients with Parkinson's disease? A. Wide base gait. B. Shuffling gait. C. Steppage gait. D. High stepping gait. Answer: B. Shuffling gait. Rationale: a shuffling gait is a common characteristic of Parkinson's disease, where the steps are short and the feet may scrape the floor. 83. A patient with Parkinson's disease reports feeling stuck when attempting to walk. This symptom is referred to as A. Dysphagia. B. Bradykinesia. C. Freezing of gait. D. Postural instability. Answer: C. Freezing of gait. Rationale: freezing of gait occurs when a person feels unable to initiate or continue walking, often described as being stuck in place. 84. Which of the following interventions is least likely to help with Parkinson's disease-related tremors? A. Levodopa. B. Anticholinergic medications. C. Beta blockers. D. Deep brain stimulation. Answer: C. Beta blockers. Rationale: beta blockers are generally not effective for treating tremors associated with Parkinson's disease. Dopaminergic therapy, anticholinergics, and DBS are more effective. 85. Which of the following is a potential complication of long-term levodopa therapy in Parkinson's disease? A. Motor fluctuations and dyskinesias. B. Cognitive improvement. C. Hyperglycemia. D. Insomnia. Answer: A. Motor fluctuations and dyskinesias. Rationale: long-term levodopa therapy is often associated with motor fluctuations, e.g., wearing off, and dyskinesias, involuntary movements. 86. What is the recommended approach for managing constipation in patients with Parkinson's disease? A. Increased fluid and fiber intake. B. Administration of anticholinergic agents. C. Limiting physical activity. D. Increased protein intake. Answer: A. Increased fluid and fiber intake. Rationale: constipation is common in Parkinson's disease and can be managed by increasing fluid and fiber intake, along with maintaining regular physical activity. 87. A Parkinson's disease patient is experiencing difficulty maintaining an upright posture. Which of the following strategies is most likely to help improve this symptom? A. Use of a walker. B. Medication adjustments. C. Posture-correcting exercises. D. Bed rest. Answer: C. Posture-correcting exercises. Rationale: postural instability can be improved with exercises designed to strengthen core muscles and enhance posture. 88. Which of the following lifestyle modifications is recommended for a patient with Parkinson's disease to help maintain functional independence? A. High-fat diet. B. Regular physical activity and exercise. C. Sedentary lifestyle. D. Complete avoidance of social activities. Answer: B. Regular physical activity and exercise. Rationale: regular exercise is critical for maintaining mobility, muscle strength, and functional independence in Parkinson's disease. 89. Which of the following clinical findings is considered a diagnostic feature of Parkinson's disease? A. Positive response to levodopa therapy. B. Presence of a positive genetic marker. C. Brain atrophy on imaging. D. Spinal cord lesions on MRI. Answer: A. Positive response to levodopa therapy. Rationale: a positive response to levodopa is often a key diagnostic feature, as it typically alleviates motor symptoms in Parkinson's disease. 90. Which of the following is a recommended strategy for managing drooling in Parkinson's disease? A. Anticholinergic medications. B. Increased fluid intake. C. Deep brain stimulation. D. Increased fiber intake. Answer: A. Anticholinergic medications. Rationale: anticholinergics can help reduce drooling by decreasing saliva production, which is a common issue in Parkinson's disease. 91. Which of the following is the most appropriate first-line treatment for Parkinson's disease-related motor symptoms in elderly patients? A. Levodopa/carbidopa. B. MAOB inhibitors. C. Amantadine. D. Deep brain stimulation. Answer: A. Levodopa/carbidopa. Rationale: Levodopa/carbidopa is generally considered the most effective first-line treatment for motor symptoms, particularly in elderly patients. 92. A patient with Parkinson's disease presents with wearing off phenomena. What is the most likely cause of this symptom? A. Overdose of levodopa. B. Insufficient levodopa levels due to disease progression. C. Interaction with other medications. D. Cognitive decline. Answer: B. Insufficient levodopa levels due to disease progression. Rationale: wearing off refers to the phenomenon where levodopa's effectiveness diminishes before the next dose is due, often as the disease progresses and more dopamine-producing cells are lost. 93. A patient with Parkinson's disease is experiencing visual hallucinations. Which medication is most likely to be the cause of the symptom? A. Levodopa. B. Dopamine agonists. C. MAOB inhibitors. D. Anticholinergics. Answer: B. Dopamine agonists. Rationale: dopamine agonists are commonly associated with visual hallucinations, especially in advanced stages of Parkinson's disease. 94. In Parkinson's disease, which of the following interventions is most beneficial for managing postural instability? A. Deep brain stimulation. B. Levodopa/carbidopa therapy. C. Balance and strengthening exercises. D. High-protein diet. Answer: seed balance and strengthening exercises. Rationale: postural instability can be improved by exercises aimed at improving balance, core strength, and motor coordination. 95. Which of the following is a common non-motor symptom of Parkinson's disease? A. Spasticity. B. Urinary incontinence. C. Visual impairment. D. Resting tremor. Answer: B. Urinary incontinence. Rationale: urinary incontinence is a common non-motor symptom of Parkinson's disease, often due to autonomic dysfunction. 96. A patient with Parkinson's disease reports feeling depressed. Which of the following is an appropriate first step in management? A. Increase levodopa dose. B. Start an SSRI antidepressant. C. Initiate deep brain stimulation. D. Encourage relaxation techniques. Answer: B. Start an SSRI antidepressant. Rationale: depression in Parkinson's disease can be managed with antidepressants such as SSRIs, in addition to supportive therapies. 97. What is the primary goal of Parkinson's disease treatment in the early stages? A. Cure the disease. B. Alleviate motor symptoms. C. Prevent cognitive decline. D. Prevent postural instability. Answer: B. Alleviate motor symptoms. Rationale: the primary goal of treatment in the early stages of Parkinson's disease is to alleviate motor symptoms such as tremors, bradykinesia, and rigidity. 98. Which of the following is a potential side effect of levodopa therapy in Parkinson's disease patients? A. Dizziness and orthostatic hypotension. B. Weight gain. C. Increased heart rate. D. Skin rash. Answer: A. Dizziness and orthostatic hypotension. Rationale: levodopa can cause dizziness and orthostatic hypotension due to its effect on the autonomic nervous system, leading to a drop in blood pressure upon standing. 99. A Parkinson's disease patient reports worsening symptoms later in the day, with a feeling of stiffness and slowness. Which of the following is the most likely explanation? A. Wearing off effect. B. Overdose of levodopa. C. Cognitive decline. D. Dopamine receptor resistance. Answer: A. Wearing off effect. Rationale: the wearing off effect refers to the return of Parkinson's symptoms, such as stiffness and slowness, before the next dose of medication is due, commonly seen with prolonged levodopa use. 100. What is the most common side effect of dopamine agonists used in Parkinson's disease? A. Sleep disturbances. B. Visual hallucinations. C. Constipation. D. Increased libido. Answer: B. Visual hallucinations. Rationale: Visual hallucinations are a common side effect of dopamine agonists, especially in older patients or those with advanced disease. 101. Which of the following is the primary neurochemical deficiency in Parkinson's disease? A. Serotonin. B. Acetylcholine. C. Dopamine. D. Norepinephrine. Answer: C. Dopamine. Rationale: Parkinson's disease is primarily characterized by a deficiency of dopamine due to the degeneration of dopaminergic neurons in the substantia nigra. 102. A patient with Parkinson's disease is exhibiting symptoms of excessive daytime sleepiness. Which of the following medications may be contributing to this? A. Levodopa. B. Anticholinergics. C. MAO-B inhibitors. D. Dopamine agonists. Answer: D. Dopamine agonists. Rationale: dopamine agonists, such as pramipexole, can cause excessive daytime sleepiness as a side effect. 103. A patient with Parkinson's disease has been prescribed indicapone as part of their treatment regimen. What is the main purpose of this medication? A. Increase dopamine release. B. Inhibit dopamine breakdown. C. Enhance the effects of dopamine agonists. D. Block acetylcholine receptors. Answer: B. Inhibit dopamine breakdown. Rationale: Indicapone is a COMT inhibitor that works by inhibiting the breakdown of dopamine, thus extending the effects of levodopa. 104. What is a common adverse effect of MAO-B inhibitors in Parkinson's disease? A. Gastrointestinal bleeding. B. Hypertension. C. Hyperkalemia. D. Insomnia. Answer: B. Hypertension. Rationale: MAO-B inhibitors can increase the levels of certain neurotransmitters, leading to an increased risk of hypertension, especially if consumed with foods rich in tyramine. 105. Which of the following best describes the effect of levodopa in Parkinson's disease? A. It increases the production of dopamine. B. It inhibits the breakdown of dopamine. C. It acts as a dopamine receptor agonist. D. It reduces dopamine production. Answer: A. It increases the production of dopamine. Rationale: levodopa is a precursor to dopamine and works by increasing dopamine levels in the brain, which helps improve motor symptoms. 106. Which of the following interventions is most helpful in addressing Parkinson's disease-related depression? A. Dopamine agonists. B. MAO-B inhibitors. C. SSRIs or SNRIs. D. Anticholinergic medications. Answer: C. SSRIs or SNRIs. Rationale: SSRIs or SNRIs are the first-line treatments for depression in Parkinson's disease and can help improve mood and well-being. 107. In Parkinson's disease, which of the following non-pharmacological interventions is most effective in managing gait and balance issues? A. Speech therapy. B. Physical therapy. C. Cognitive behavioral therapy. D. Occupational therapy. Answer: B. Physical therapy. Rationale: physical therapy focuses on improving gait, balance, and mobility, which are commonly affected in Parkinson's disease. 108. A patient with Parkinson's disease is taking amantadine. What is the primary benefit of this medication? A. It reduces rigidity. B. It increases dopamine release. C. It inhibits dopamine breakdown. D. It improves cognitive function. Answer: B. It increases dopamine release. Rationale: amantadine is a dopamine-releasing agent that helps alleviate motor symptoms in Parkinson's disease by increasing dopamine activity in the brain. 109. A 60-year-old male with Parkinson's disease is experiencing difficulty with fine motor tasks, such as buttoning his shirt. Which of the following interventions is most likely to help? A. Levodopa/carbidopa. B. Occupational therapy. C. Dopamine agonists. D. Cognitive behavioral therapy. Answer: B. Occupational therapy. Rationale: occupational therapy is beneficial for improving fine motor skills and performing daily activities, which is often a challenge for patients with Parkinson's disease. 110. Which of the following motor symptoms is most commonly seen in Parkinson's disease? A. Tremor at rest. B. Hyperreflexia. C. Spasticity. D. Muscle weakness. Answer: A. Tremor at rest. Rationale: Resting tremor is one of the hallmark motor symptoms of Parkinson's disease, occurring when the muscles are at rest and improving with movement. 111. Which of the following is the most common non-motor symptom in Parkinson's disease? A. Anxiety. B. Dysphagia. C. Depression. D. Insomnia. Answer: C. Depression. Rationale: depression is one of the most common non-motor symptoms in Parkinson's disease, affecting a significant number of patients. 112. A Parkinson's disease patient is experiencing muscle rigidity. Which of the following is the most appropriate initial treatment? A. Levodopa/carbidopa. B. Anticholinergic agents. C. MAOB inhibitors. D. Physical therapy. Answer: A. Levodopa/carbidopa. Rationale: levodopa/carbidopa is the first-line treatment for motor symptoms, including rigidity, and is effective in improving muscle stiffness in Parkinson's disease. 113. Which of the following is a known risk factor for developing Parkinson's disease? A. Smoking. B. Family history of Parkinson's disease. C. Excessive physical activity. D. High-fat diet. Answer: B. Family history of Parkinson's disease. Rationale: family history is a known risk factor for Parkinson's disease, as genetics can play a role in its development. 114. A patient with Parkinson's disease is prescribed a dopamine agonist. What is the primary role of dopamine agonists in Parkinson's treatment? A. Inhibit dopamine breakdown. B. Directly stimulate dopamine receptors. C. Increase dopamine release. D. Block acetylcholine receptors. Answer: B. Directly stimulate dopamine receptors. Rationale: dopamine agonists directly stimulate dopamine receptors in the brain, providing an alternative to dopamine replacement therapy in Parkinson's disease. 115. A patient with Parkinson's disease is starting levodopa therapy. Which of the following side effects is most commonly associated with this medication? A. Weight gain. B. Dizziness and orthostatic hypotension. C. Constipation. D. Insomnia. Answer: B. Dizziness and orthostatic hypotension. Rationale: levodopa can cause dizziness and orthostatic hypotension, particularly when transitioning from sitting or lying down to standing. 116. Which of the following is the most effective pharmacologic treatment for managing Parkinson's disease-related tremor? A. Levodopa/carbidopa. B. Anticholinergic drugs. C. Amantadine. D. Dopamine agonists. Answer: B. Anticholinergic drugs. Rationale: anticholinergic medications are particularly effective in reducing tremor in Parkinson's disease, though they are used less frequently due to side effects in older adults. 117. A Parkinson's disease patient is prescribed deep brain stimulation. Which of the following best describes the mechanism of this treatment? A. It increases dopamine release. B. It stimulates specific brain regions to reduce symptoms. C. It blocks abnormal brain wave activity. D. It replaces dopamine in the brain. Answer: B. It stimulates specific brain regions to reduce symptoms. Rationale: deep brain stimulation involves the implantation of electrodes to stimulate specific regions of the brain, helping to control symptoms like tremor, rigidity, and bradykinesia. 118. A Parkinson's disease patient experiences freezing of gait, where they are temporarily unable to initiate movement. Which intervention is most helpful in this situation? A. Levodopa/carbidopa. B. Gait training with a physical therapist. C. Dopamine agonists. D. Anticholinergics. Answer: B. Gait training with a physical therapist. Rationale: freezing of gait can often be improved with gait training and physical therapy to teach strategies for initiating movement and overcoming the freezing episodes. 119. Which of the following is a common complication in Parkinson's disease patients treated with long-term levodopa therapy? A. Cognitive decline. B. Hyperkalemia. C. Dyskinesia. D. Hyperglycemia. Answer: C. Dyskinesia. Rationale: dyskinesia, or involuntary movements, is a common complication of long-term levodopa therapy, often occurring after several years of treatment. 120. What is the primary mechanism of action of levodopa in Parkinson's disease? A. It blocks acetylcholine activity. B. It replaces dopamine in the brain. C. It increases dopamine receptor sensitivity. D. It inhibits the breakdown of dopamine. Answer: B. It replaces dopamine in the brain. Rationale: levodopa is a precursor to dopamine and is converted into dopamine in the brain to replenish dopamine levels, which helps improve motor symptoms in Parkinson's disease. 121. A Parkinson's disease patient is taking selegiline. Which of the following is a potential side effect of this medication? A. Insomnia. B. Hypotension. C. Weight loss. D. Skin rash. Answer: A. Insomnia. Rationale: selegiline, an MAOB inhibitor, can cause insomnia, particularly when taken later in the day. 122. Which of the following statements about Parkinson's disease is most accurate? A. Parkinson's disease primarily affects the upper motor neurons. B. Parkinson's disease primarily affects the basal ganglia. C. Parkinson's disease is a reversible disorder. D. Parkinson's disease is caused by a viral infection. Answer: B. Parkinson's disease primarily affects the basal ganglia. Rationale: Parkinson's disease is primarily a disorder of the basal ganglia, particularly the substantia nigra, leading to dopamine deficiency and motor symptoms. 123. Which of the following medications is often used to treat Parkinson's disease in patients who are younger and have fewer motor symptoms? A. Levodopa/carbidopa. B. Dopamine agonists. C. Anticholinergic drugs. D. MAOB inhibitors. Answer: B. Dopamine agonists. Rationale: dopamine agonists are often preferred for younger patients with fewer motor symptoms as they can delay the need for levodopa therapy and are associated with fewer motor complications. 124. A Parkinson's disease patient reports feeling more anxious and having difficulty sleeping. Which of the following interventions would most likely improve these symptoms? A. Increase levodopa dose. B. Start an SSRI antidepressant. C. Prescribe dopamine agonists. D. Encourage deep brain stimulation. Answer: B. Start an SSRI antidepressant. Rationale: SSRIs are often used to manage anxiety and improve sleep quality in patients with Parkinson's disease, addressing both mood and non-motor symptoms. 125. What is the first-line treatment for Parkinson's disease in patients with mild symptoms? A. Levodopa/carbidopa. B. Anticholinergic medications. C. Dopamine agonists. D. MAOB inhibitors. Answer: D. MAOB inhibitors. Rationale: MAOB inhibitors are often used as first-line therapy in patients with mild symptoms to inhibit the breakdown of dopamine, offering symptom control with fewer side effects. 126. A 65-year-old Parkinson's disease patient is experiencing difficulty with swallowing. Which of the following interventions is most appropriate? A. Initiate speech therapy. B. Increase levodopa dose. C. Prescribe anticholinergics. D. Recommend a soft food diet. Answer: A. Initiate speech therapy. Rationale: speech therapy is essential for patients with Parkinson's disease who experience dysphagia, difficulty swallowing. Speech therapists can help with swallowing techniques and improve safety during eating. 127. A Parkinson's disease patient is prescribed amantadine. What is the primary purpose of this medication in Parkinson's treatment? A. Increase dopamine release. B. Stimulate dopamine receptors. C. Inhibit dopamine breakdown. D. Block acetylcholine activity. Answer: A. Increase dopamine release. Rationale: amantadine works by increasing dopamine release from nerve terminals, providing symptom relief for patients with Parkinson's disease. 128. A Parkinson's disease patient is struggling with depression. Which of the following treatments would most likely benefit this patient? A. Dopamine agonists. B. SSRI antidepressants. C. Levodopa therapy. D. MAOB inhibitors. Answer: B. SSRI antidepressants. Rationale: SSRIs, selective serotonin reuptake inhibitors, are commonly prescribed to manage depression in Parkinson's disease patients, as depression is a common non-motor symptom. 129. Which of the following is the primary goal of treatment in Parkinson's disease? A. Complete cure of the disease. B. Prevention of disease progression. C's management of motor symptoms and improvement of quality of life. D. Improvement of cognitive function. Answer: C's management of motor symptoms and improvement of quality of life. Rationale: the main treatment goal in Parkinson's disease is symptom management, especially motor symptoms, to improve the patient's quality of life. 130. A patient with Parkinson's disease develops postural instability, leading to frequent falls. Which of the following interventions would be most effective in improving balance? A. Dopamine agonists. B. Occupational therapy. C. Physical therapy. D. Anticholinergics. Answer: C. Physical therapy. Rationale: physical therapy, including balance training and strengthening exercises, is crucial for improving postural stability and reducing the risk of falls in Parkinson's disease patients. 131. Which of the following would be an important aspect of patient education for someone starting levodopa therapy for Parkinson's disease? A. Take this medication with food to reduce nausea. B. You should avoid high-protein foods while taking this medication. C. You should limit your fluid intake to avoid dehydration. D. This medication will reverse your Parkinson's symptoms. Answer: B. You should avoid high-protein foods while taking this medication. Rationale: high-protein foods can interfere with the absorption of levodopa, so patients are often advised to take levodopa on an empty stomach or with low-protein meals. 132. What is the role of deep brain stimulation, DBS, in the treatment of Parkinson's disease? A. DBS is used as a first-line treatment. B. DBS is used when patients no longer respond to medications. C. DBS is a surgical treatment that cures Parkinson's disease. D. DBS replaces dopamine therapy. Answer: B. DBS is used when patients no longer respond to medications. Rationale: deep brain stimulation is a surgical option for patients with Parkinson's disease who no longer respond adequately to medications, helping to control symptoms like tremors and rigidity. 133. Which of the following is a potential side effect of dopamine agonists in Parkinson's disease treatment? A. Drowsiness and sleep attacks. B. Hypertension. C. Increased appetite. D. Tachycardia. Answer: A. Drowsiness and sleep attacks. Rationale: dopamine agonists can cause drowsiness and sleep attacks, which may interfere with daily activities and potentially lead to accidents. 134. Which of the following is the most likely cause of the motor symptoms in Parkinson's disease? A. Overproduction of dopamine. B. Decreased dopamine levels in the brain. C. Increased serotonin activity. D. Excessive acetylcholine. Answer: B. Decreased dopamine levels in the brain. Rationale: the motor symptoms of Parkinson's disease are caused by the degeneration of dopamine-producing neurons in the substantia nigra, leading to reduced dopamine levels in the brain. 135. Which of the following is a characteristic feature of Parkinson's disease-related tremors? A. Tremors are present during sleep. B. Tremors occur only with purposeful movement. C. Tremors are more noticeable when the patient is at rest. D. Tremors involve the entire body symmetrically. Answer: C. Tremors are more noticeable when the patient is at rest. Rationale: resting tremor is a hallmark symptom of Parkinson's disease, typically occurring when the patient is not engaged in voluntary movement. 136. What is the typical age of onset for Parkinson's disease? A. Before 30 years of age. B. Between 30 and 40 years of age. C. Between 45 and 65 years of age. D. Over 70 years of age. Answer: C. Between 45 and 65 years of age. Rationale: Parkinson's disease most commonly begins between the ages of 45 and 65, although it can occur earlier or later in life. 137. A Parkinson's disease patient is reporting significant fatigue. Which of the following is the most appropriate response? A. Recommend an increase in exercise. B. Increase the dose of levodopa. C. Assess for other underlying causes of fatigue, such as depression. D. Recommend a high-calorie diet. Answer: C. Assess for other underlying causes of fatigue, such as depression. Rationale: fatigue can be a symptom of depression or other non-motor symptoms in Parkinson's disease, and it is important to evaluate for these conditions. 138. Which of the following is an example of a non-motor symptom of Parkinson's disease? A. Resting tremor. B. Rigidity. C. Bradykinesia. D. Sleep disturbances. Answer: D. Sleep disturbances. Rationale: sleep disturbances, such as insomnia or REM sleep behavior disorder, are common non-motor symptoms of Parkinson's disease. 139. What is the role of MAOB inhibitors in the treatment of Parkinson's disease? A. They replace dopamine in the brain. B. They stimulate dopamine receptors. C. They inhibit the breakdown of dopamine. D. They block acetylcholine. Answer: C. They inhibit the breakdown of dopamine. Rationale: MAOB inhibitors, such as selegiline and razagiline, work by inhibiting the enzyme monoamine oxidase B, which breaks down dopamine, thereby increasing available dopamine in the brain. 140. A Parkinson's disease patient is experiencing worsening dyskinesia after long-term use of levodopa. What is the most appropriate intervention? A. Decrease the levodopa dose. B. Start a dopamine agonist. C. Add an MAB inhibitor. D. Start anticholinergic medication. Answer: A. Decrease the levodopa dose. Rationale: dyskinesia is often associated with long-term levodopa therapy, and a reduction in the levodopa dose or adjustment to the medication regimen can help manage the side effect. 141. Which of the following is a common early sign of Parkinson's disease? A. Hemiplegia. B. Resting tremor. C. Numbness in the extremities. D. Spasticity. Answer: B. Resting tremor. Rationale: resting tremor is one of the hallmark early symptoms of Parkinson's disease, often starting on one side of the body and affecting the hands or fingers. 142. A Parkinson's disease patient has difficulty initiating movement. Which of the following terms best describes the symptom? A. Rigidity. B. Bradykinesia. C. Dysphagia. D. Postural instability. Answer: B. Bradykinesia. Rationale: bradykinesia, or slowness of movement, is a key symptom of Parkinson's disease and refers to difficulty initiating and performing voluntary movements. 143. Which of the following is a potential side effect of levodopa therapy in Parkinson's disease patients? A. Hyperactivity. B. Weight loss. C. Orthostatic hypotension. D. Increased appetite. Answer: C. Orthostatic hypotension. Rationale: levodopa therapy can cause orthostatic hypotension, which is a drop in blood pressure when transitioning from lying down to standing up. This can lead to dizziness or falls. 144. Which of the following interventions is important in preventing falls in Parkinson's disease patients? A. Limiting physical activity. B. Increasing protein intake. C. Use of walking aids and physical therapy. D. Encouraging sedentary lifestyle. Answer: C. Use of walking aids and physical therapy. Rationale: physical therapy and the use of walking aids can significantly reduce the risk of falls by improving balance and mobility in Parkinson's disease patients. 145. A Parkinson's disease patient reports worsening tremor despite current medication. Which of the following medications is likely to be considered next? A. Anticholinergics. B. MAOB inhibitors. C. Benzodiazepines. D. Levodopa/carbidopa. Answer: D. Levodopa/carbidopa. Rationale: levodopa/carbidopa is the primary treatment for Parkinson's disease symptoms, including tremor, and may be adjusted if symptoms worsen. 146. What is the function of carbidopa in the combination of levodopa/carbidopa for Parkinson's disease treatment? A. It increases the absorption of levodopa. B. It prevents the breakdown of levodopa in the periphery. C. It enhances the effect of dopamine agonists. D. It inhibits dopamine receptor activity. Answer: B. It prevents the breakdown of levodopa in the periphery. Rationale: carbidopa prevents the premature breakdown of levodopa in the peripheral tissues, ensuring more levodopa reaches the brain where it can be converted to dopamine. 147. Which of the following is a common non-motor symptom of Parkinson's disease that affects a patient's quality of life? A. Insomnia. B. Resting tremor. C. Muscle rigidity. D. Bradykinesia. Answer: A. Insomnia. Rationale: Non-motor symptoms like insomnia can significantly affect the quality of life in Parkinson's disease patients, contributing to fatigue and mood disturbances. 148. Which of the following lifestyle changes can help manage Parkinson's disease symptoms? A. High-calcium diet. B. Regular physical exercise. C. Low-sodium diet. D. High-fat diet. Answer. B. Regular physical exercise. Rationale: regular physical exercise, including balance and strength training, is highly beneficial for managing symptoms such as bradykinesia, rigidity, and postural instability in Parkinson's disease. 149. Which of the following is a potential complication of untreated Parkinson's disease? A. Hepatitis. B. Respiratory failure. C. Gastrointestinal bleeding. D. Cardiovascular disease. Answer. B. Respiratory failure. Rationale: untreated Parkinson's disease can lead to complications such as respiratory failure, particularly as muscle weakness and postural instability interfere with breathing and swallowing. 150. How does the progression of Parkinson's disease typically affect a patient's gait? A. They develop a wide-based gait. B. They experience shuffling, shortened steps. C. They develop an unsteady, staggering gait. D. They have a high-stepping gait. Answer. B. They experience shuffling, shortened steps. Rationale: one of the classic signs of Parkinson's disease is a shuffling gait, with small, slow steps and reduced arm swing. 151. Which of the following is a common cognitive issue associated with Parkinson's disease? A. Dementia. B. Agoraphobia. C. Delirium. D. Amnesia. Answer. A. Dementia. Rationale: cognitive decline, including dementia, is common in later stages of Parkinson's disease, affecting memory, attention, and executive function. 152. A Parkinson's disease patient presents with frequent urinary urgency and incontinence. Which of the following treatments would be most beneficial for managing this symptom? A. Dopamine agonists. B. Anticholinergic medications. C. MAOB inhibitors. D. Antidepressants. Answer. B. Anticholinergic medications. Rationale: anticholinergics can help manage urinary urgency and incontinence in Parkinson's disease patients by reducing overactive bladder symptoms. 153. Which of the following non-pharmacological interventions can assist in managing Parkinson's disease symptoms? A. Yoga and meditation. B. Deep brain stimulation, DBS. C. Electroconvulsive therapy, ECT. D. Acupuncture. Answer. A. Yoga and meditation. Rationale: yoga and meditation can be beneficial for Parkinson's disease patients in reducing stress, improving flexibility, and promoting overall well-being. 154. Which of the following is a key consideration when administering levodopa therapy to elderly Parkinson's disease patients? A. Levodopa should be started at the highest dose. B. Patients may experience an increased risk of hallucinations. C. Levodopa therapy has no side effects in elderly patients. D. Levodopa should be given only once daily. Answer. B. Patients may experience an increased risk of hallucinations. Rationale: elderly patients are at higher risk for developing psychiatric side effects, such as hallucinations, when on levodopa therapy. 155. Which of the following Parkinson's disease treatments may cause the onset of on-off fluctuations? A. Levodopa. B. MAOB inhibitors. C. Dopamine agonists. D. Anticholinergic drugs. Answer. A. Levodopa. Rationale: on-off fluctuations are a well-known side effect of long-term levodopa therapy, where patients experience periods of good symptom control, on, and periods of poor control, off. 156. A Parkinson's disease patient is showing signs of freezing gait. What is the best approach to managing the symptom? A. Increase the levodopa dosage. B. Use cognitive behavioral therapy. C. Provide physical therapy with gait training. D. Introduce anticholinergic medications. Answer. C. Provide physical therapy with gait training. Rationale: freezing gait is a common symptom in Parkinson's disease, and physical therapy, including specific gait training techniques, is effective in reducing this problem. 157. Which of the following is a major risk factor for the development of Parkinson's disease? A. Smoking. B. Advanced age. C. High-fat diet. D. High levels of physical activity. Answer: B. Advanced age. Rationale: advanced age is the most significant risk factor for Parkinson's disease, with the disease typically manifesting in people aged 60 years or older. 158. What is the mechanism of action of COMT inhibitors in Parkinson's disease treatment? A. Increase dopamine release. B. Inhibit dopamine breakdown. C. Block dopamine receptors. D. Stimulate acetylcholine release. Answer: B. Inhibit dopamine breakdown. Rationale: COMT inhibitors, such as entacapone, work by inhibiting the enzyme catecholomethyltransferase, which breaks down dopamine, thereby increasing the availability of dopamine. 159. Which of the following interventions is most likely to improve sleep quality in Parkinson's disease patients? A. Increase levodopa dosage at bedtime. B. Use sedative medications regularly. C. Encourage a consistent sleep routine and environment. D. Restrict fluids before bedtime. Answer: C. Encourage a consistent sleep routine and environment. Rationale: establishing a consistent sleep routine and a calming environment can significantly improve sleep quality in Parkinson's disease patients. 160. A Parkinson's disease patient is being treated with a dopamine agonist. Which of the following side effects should be monitored for? A. Weight gain. B. Impulse control disorders. C. Dizziness upon standing. D. Hyperglycemia. Answer: B. Impulse control disorders. Rationale: dopamine agonists can cause impulse control disorders, such as pathological gambling or hypersexuality, and patients should be monitored for these side effects.